So this was a short essay in Pathology 2017 supplementary exam. The answer is systemic lupus erythematosus. SLE is very important and it is repeatedly asked in both university and sessional exams. Now let us review systemic lupus erythematosus or SLE. So first of all, what is it? It's basically a chronic multisystemic autoimmune disease. It is a chronic multisystemic autoimmune disease. Now, even though it is chronic, it can have relapses and remissions from time to time. Now, it is multisystemic. So, what are the systems that are involved? Mainly, they are the skin, kidney, joints, heart. They are skin, kidney, joint, heart. Now, it is said that it is an autoimmune disease. That means the body produces antibodies that can damage our own cells. So, we can say that SLE is a disease of our immune system. Now, let us move on to the clinical features. It is observed that it is usually seen in young reproductive women, and the cause for this will be dealt in the etiology part. Now, what are the other symptoms? It include butterfly-like rashes or malar rashes on the face. There can be discoid rashes. There can be photosensitivity. There can be arthritis, oral ulcer. And since it is a systemic disease, they can have renal, hematological, neurological disorders. The presentation of SLE is usually variable. Now, moving on to etiology. If we are to explain the SLE in a single sentence, we can say that there are some factors which causes a loss of self-tolerance, and this in turn increases the number of autoantibodies, and that damage our body. Now, self-tolerance are a set of mechanisms that prevent our body from attacking our own cells. Now, what are these etiological factors? They can be broadly divided into three. They are environmental, genetic, and immunological. Now, environmental is something that start or initiate the process, whereas the genetic and immunological factors can progress the disease. Now, what are the environmental factors? They include UV radiation, cigarette smoking, drugs, example hydralazine, which is a vasodilator, isoniazid, etc., and also the sex hormone. It is seen that the women of reproductive age have more chance of this disease due to increased amount of estrogen. Now, to understand about the genetic and immunological factors, we need to have thorough knowledge in our immune system. So for the time being, let us just see what all they are. First of all, genetic. It includes defect of human leukocyte antigen, complement components, Fc receptors, and in immunological, there is increased level of interferon alpha. There might be defect in toll-like receptors, and there will be failure of B cell tolerance. Now moving on to pathogenesis or mechanism. For this, we can take the example of UV radiation. We know that it can damage our cells. Now what happened to the damaged cells? They undergo a process known as apoptosis. It's basically a suicidal program. Now the apoptosed cells fragment into pieces, and these are known as apoptotic bodies. Now usually they are cleared out from the body by the complement system, but in SLE the complement system is defected, so it is not removed properly. This forms the first part of the pathogenesis. Now the B cells in SLE patient have lost the ability of self-tolerance. Now they mistakes the apoptotic bodies as foreign threat and start producing antibodies against them. Now these antibodies combine with the apoptotic body particles to form antigen antibody complexes. Now note that these complexes get deposited in various parts of our body and injure our cells. And also some of the complexes get engulfed by the B cells and dendritic cells and activate their toll-like receptors. These are also defected. So it stimulates more and more B cells and dendritic cells to produce more antibodies against our own cells, and thus the immune response is amplified. Now what happens when this get amplified? It damages more and more cells go into apoptosis, and the cycle go on and on until a stage of self-destruction sets in the body. Moving on to the types of autoantibodies that are seen in SLE. Broadly, we can classify them as anti-nuclear antibodies and also the other types of antibodies. The most common type of anti-nuclear antibodies include anti-double-stranded DNA, anti-Smith antibody. Note that these are the specific antibodies in SLE. Now there are also anti-histone antibodies, antibodies to DNA. Antibodies of DNA are used in screening. Now there are also other types of antibodies, a wide range of antibodies seen in SLE. Some of them include antibodies against the blood cells. These are responsible for the cytopenias seen in SLE. Now other set include anti-phospholipid antibodies. These are important because these antibodies can cause thrombosis, and these thrombosis lead to a variety of ischemias including cerebral ischemia, ocular ischemia, etc. Now, what are the types of tissue injuries seen in SLE? Mainly there are two types. They are the type 3 hypersensitivity and type 2 hypersensitivity. And as we know, in type 3 hypersensitivity, it involves injuries due to the deposition of antigen antibody complexes, whereas the type 2 hypersensitivity is due to autoantibodies. Now, the morphology. Kidneys are the most common organ being affected. So, what is happening there? Antigen antibody complexes get deposited in the kidney, and this results in inflammation. And as we know, the inflammation results in infiltration of a lot of cells like neutrophils, macrophages, etc. And also it causes proliferation of endogenous cells like endothelial cells, mesangial cells, epithelial cells, etc. Now, based on its features, SLE kidneys are divided into 6 classes 1, 2, 3, 4, 5, 6. Now, these are named as Class 1 as minimal mesangial. Now, the next 3 classes end as proliferative. They are it's mesangial proliferative, focal proliferative, and diffuse proliferative. Once again, it starts from minimal mesangial, mesangial proliferative, focal proliferative, diffuse proliferative. Now class 5 is membranous and class 6 is advanced sclerosis. In minimal mesangial, it includes granular complex deposition in the kidney. When it comes to mesangial proliferative, it includes the complex, and along with that there is mesangial proliferation. In both focal and diffuse proliferative, there will be complexes, there will be infiltration, and also proliferation of the 3 cells that are endothelial, mesangial, and epithelial. In class 5, that is membranous, there will be diffuse thickening of the capillary wall, and also in class 6, that is advanced sclerosis, there will be glomerular sclerosis. Now the next common things that are being affected are the blood vessels. a condition known as acute necrotizing vasculitis occur. It is a type of fibrinoid necrosis and it causes a narrowing of the lumen. Now, coming to the heart, a warty kind of lesion is seen on their valves, and these are known as Lippmann-Sack endocarditis. Now, let us talk about LE cells. As we have told before, in a damaged cell, the nuclear material gets disintegrated by the antibodies and lost their chromosome pattern. And these nuclear materials get engulfed by phagocytic cells. And these phagocytic cells with the nuclear materials are known as LE cells. Moving on to lab diagnosis. In standard tests, we can check the total blood count, the platelet, ESR, urine analysis, etc. For specific diagnosis, we can check the presence of autoantibodies. For this, we can use the help of immune fluorescence assay, ELISA, multiplex flow cytometry, etc. We may also check the renal hematological functions to rule out any complications. We can also check the level of complement components because if its level is low, it means that it is being used up, and that means the disease might be active. The common cause of death in this disease are due to renal complication or recurrent infection due to low immunity. So that winds up the review of systemic lupus erythematosus.